Good morning, everybody. Good morning. Come on, we can do better than that. Good morning, everybody.
Good morning.
Isn't today a good day?
Yes.
It's a beautiful day in the Salinas Valley. We're sitting here and it feels like day one of this gubernatorial campaign. We're sitting here with a wide open field, and it is an honor to be in Salinas introducing somebody who's, I know, this isn't their first visit here. They've been here learning from us, and they're not quitting. Javier is here again to hear about your issues and to address them directly with you. I've got to be honest, I was an early supporter. I jumped in early behind Javier because I look at this field and I want somebody with experience, somebody who gets it, somebody who understands the issues in Monterey County and beyond, throughout this entire state, not just in theory, not just on paper, but I remember during COVID, everybody said farm workers should be given the vaccine first, until vaccines rolled out. And then folks rolled back and said, oh, well, maybe not. Let's look for the most vulnerable. Javier stood up. He looked at our community and didn't just send them from DC where he was serving us as Secretary of Health. He came out to make sure. He stood at the rodeo grounds with us shoulder to shoulder to make sure that we were supplying the community who deserved access directly. This is a man of his word, a man who has walked the walk, not just talk the talk. And in that vein, he's here today to see you, to hear from you, and to learn what the issues are here in Monterey County and beyond, because I know we have some friends from as far away as Contra Costa today with us. So thank you all for being here. Thank you all for taking the time to learn these issues. But I'm going to ask you for one more thing before I get off this stage. Don't let it end here. This gubernatorial race right now is wide open. The biggest influence on the outcome of this race is your voice. It's how you go back to community and share what you heard here, what matters, and we have to make sure that it doesn't just end in this room. Share with your friends and neighbors who Javier is, what his points of view are, because in that way, we can help spread the positive message about his campaign and what he will bring to Sacramento, and not just there, here to Monterey County, to Los Angeles, to Fresno, to Tulare, to every corner of the state that he knows through and through because he's been dedicated to us. So with that, it is my honor to introduce the next governor of the state of California, Xavier Becerra. Please give him a round of applause.
And to perhaps the best county supervisor in the state of California, Chris Lopez. Let's give him a round of applause. Actually, I've had a chance to work with mayors, county supervisors, every kind of state legislator you could think of, governors, presidents, national and international leaders. I will tell you, you are very fortunate to have Chris Lopez as one of your leaders because he shows up. I mean, he's bright and talented and all the rest. But what I like about Chris, he shows up. And very few people, once they get in office, treat you the way they treat you when they're looking for your vote. Right? When they need your vote, they're always after you. They'll call you, they'll go to your home. It's like they're serenading you. Once they're in about 4 years, they'll remember you. Chris is very different, and I appreciate that because I'm a voter too. I'm a county resident too. And I need my local leaders to be present as well. Chris Lopez is present. And so I hope you know that because as we're seeing these days, sometimes it's tough to keep good people in office for the right reasons. And so don't let go of this guy. He's been great. So Chris, thank you very much. Okay, let's do this. Some of my campaign staff were reminding me because they were with me when I was in Congress. I used to do these all the time. We used to call them coffees with your congressman. I used to love to do town halls throughout my congressional district because it gave people a chance to, again, see their elected official. And we didn't bring any pan dulce this time, but usually we would have some pan dulce and folks, maybe they came for the pan dulce, but they showed up. And we had great times. By the way, I got to tell you, I had as many detractors come to my town halls as I had supporters. And some of the best town halls were when the detractors got to ask more of the questions because people got to see an exchange back and forth. And they saw, okay, this is real. Maybe they didn't agree with me or they didn't agree with the detractor, but they got to hear both sides. And it felt like they were actually listening to a policy discussion rather than just a monologue. So that's why this is important. I'm going to do these town halls throughout the state of California to hear from folks. But I hope you've noticed something. My very first one is in the Central Coast. And that's for a reason. As I've already said it to some of you, I was born in the valley, Sacramento Valley. My wife is from Fresno, actually from Hanford. And she grew up in the Central Valley. Now, as some of you know, Clarissa, who's my daughter, but in her own right, she's an attorney. She's a member of the First Five Commission. She lives here in Salinas. And it's always the same thing I hear from families. Gosh, I wish you guys would come here more often. We exist. Not just LA and San Francisco, San Jose or Sacramento. We exist. And so I think it's so important to show up where you are. And what better way to send the message that you exist than by starting here in Salinas, not San Francisco, not LA. And so let's do this together because we want to put all of you on the map. Because when it comes to housing, you're going through as tough a time as anybody else is in the state of California. When it comes to healthcare, actually you're having a harder time. Believe it or not, it costs more to have a baby in Salinas than in San Francisco or LA. It is tough. People don't know that. We have to make sure folks understand all the different challenges that are faced throughout the state of California. So here's what I'm going to do. I'm going to just say a few more words because I want to open up this conversation to you. And I know many of you have already written down some questions. So if you've got some thoughts and you haven't written it down, please write it down. That's the best way we can make sure we try to fairly go through any questions or comments you have. This is not a regular election. Then again, I guess no election is, right? Everyone says this is the most important election ever. In so many ways it is, but it's not a regular election because the challenges that we're facing are so intense. It's not just the man-made crises coming from Washington, D.C. It's our own crises that we face here in California. I mentioned already the price of housing, not just to buy, but to rent. Healthcare. How can it be that in a small community like Salinas, it costs more than in the big cities to have a baby, to go do your prenatal care, to go do your post-hospital acute care? More expensive in a place like this. You would think that the cost of living would be less. Education. We all want to see our kids make it to college. Do you have easy access? Can you afford? Actually, you're paying tuition. If you've got a child today and you're working and you need daycare, you're essentially paying college tuition for your 3-year-old because that's how much it costs these days to do daycare for your child. That's crazy. We got to break that. As I keep saying, it's time to break glass. This is one of those crises, emergency moments where you got to break glass and do things differently, otherwise the house is going to burn down. And so what I say to folks is, when you hit a crisis like this, and you have to break glass, and you read the instructions, do not break this unless it's an emergency, and then you better know what to do. The governor's office is not a place for someone who needs on-the-job training. We need someone who knows how to govern through crisis, whether it's, as I said, some policy decision that guts $1 trillion out of healthcare and now is going to make it difficult for families in California to access hospitals and doctors, or whether it's the fact that too many young people today don't even think about buying a house because they know they don't have the down payment. It's a crisis. We need a governor who doesn't need training wheels when he or she gets in that office. And so I hope that this is your reason for being here, is that you recognize that we're all having to break that glass. And we all have to make the decisions that are going to move us forward and make people believe that they can actually make their life here in California the way my parents did. A construction worker and a secretary. A construction worker who got no further than the 6th grade because he was the oldest of 8 and he had to start working. First in the fields as a campesino, as a farm worker. And then ultimately fixing brakes on what was Southern Pacific Railroad, and then working in road construction during the heyday of freeways. in the 60s and 70s. Now I feel like I'm at home, because now, like in church, right? It's not a mass until some baby is crying really loud and making it tough for the priest. But that's what makes it home. So welcome, and thank you for being children. And so we have to be ready, and we need people who know how to do this. And this is where I believe that as people begin to pay attention to this race, and they look, who actually knows how to deal in a crisis? Who knows how to balance a budget the size of the state of California right now when we got deficits? Well, look for someone who's actually balanced a budget as large as the budget of the state of California. There's only one candidate who's had to balance a budget as large as the budget of the state of California. Me. Thing is, the only difference is my budget was larger than the budget of the state of California when I was Secretary of the Department of Health and Human Services. How large was it? Well, you could take the budget of the state of California, and then you could take the budget of that behemoth called the Department of Defense, and you could combine those two budgets, and my budget at the Department of Health and Human Services was bigger than the Department of Defense's budget and the state of California's budget combined. And 4 years in a row, I had to balance my budget, because the Constitution doesn't allow me to spend any money that hasn't been approved by Congress. Crisis, emergency? Who has had to declare a crisis, a state of emergency of the candidates that are running at the scale of California? Only one candidate, me. I had to declare several states of national emergency. I took over right during the depth of COVID. And so we had to constantly try to get 50 states to work together. Because remember, under our US Constitution, healthcare is not the province, is not the prerogative of the federal government. Every state gets to do healthcare how they want. But when you've got a crisis of national scope, you need to work together. So we declared a national health crisis, and that gave us extraordinary powers to try to get the states to work with us together. We still had to respect their rights under the Constitution, but we were able to work together with them. And that's how we were able to distribute more than 700 million COVID shots that went into your arms. Never done before in the history of the country. Never. But the thing I'm most proud of, if you got that COVID vaccine, how much did you pay? There's not a person in this country, while we were in office trying to get us past COVID, who made you pay 1 penny for that life-saving vaccine. And it made no difference to us what your income was, what your zip code was, or what your immigration status was. We made it available to everybody. Yes. Crises can be national in scope, or they can be crises that affect a state as big as the 4th largest economy in the world, California. Or they can be smaller, like the crisis that hit Lahaina in Maui, in Hawaii, when it went up in flames, which for the state of Hawaii was a major crisis, because that smaller state could not handle the entire burning of a city. And so they called the White House. We can't cope. We're losing people. We don't know who they are. We don't know where they are. I had to declare a state of national health emergency. And we are the ones that actually had to start helping identify bodies. So families finally got closure on who they had lost or where their loved one might be. It's because their coroners were so busy with other things, they couldn't cope. We went in, we declared a state of emergency. I deployed resources and personnel to address it. Only one candidate could tell you they've done that. And so it's time for us to recognize that in this time of crisis, we got to move forward. We got to make young people believe that they will be able to buy a home. They'll be able to raise their family here, send them to college, the way my parents did for my 3 sisters and me. And then when it's all over after decades of work, they don't have to move to Idaho or Arizona to retire. They can retire here in California. As my parents, a construction worker and a clerical worker, were able to do. That's my job. I'm going to tell you over the next hour how we're going to do that. And that's why I'm happy you're here. I hope you're going to ask some great questions. More importantly, you did me a favor. You proved that if I go to places like the Central Coast, you will come too. So thank you so much. And to our supervisor, Chris Lopez, thank you for being here. And I'm going to make him answer some questions too, because I know some of your questions will be very local, and I know he knows it better than I do. Thank you all. Let's get to some questions. So here's the way we used to do it when I did my coffees with your congressman when I was a member of Congress. We asked you to put your questions, and so no one thought it was favoritism that I answered, my sister's question before anybody else's. We would pick them randomly. So this will be the first one. This will be the second. This way we keep it moving. So the first question, do we no name on it? There's no name? Okay. So the first question, if you can identify yourself, if I'm not reading your question, how will you lead in California by ensuring health care access to all and not relying solely on the federal monies? Who asked that question? Yes, give us your name. Debbie?
Debbie.
Debbie, what's the last name? Narvaez. So Debbie asked again, how will you lead in California by ensuring health care access to all and not relying solely on the federal monies? So you know this, I know this. Health care is not a commodity, right? You can't just sort of say, oh, my child is really ailing, really hurting. Maybe I'll buy aspirin and see what happens. You try that. If you don't have insurance, that's oftentimes what you do. My parents always couldn't afford it, so they would, the Sovalora or whatever it was, they would try different ways to avoid having to go to the doctor or hospital because it's too expensive. But at some point, it gets so bad, you're not going to wait. That's your loved one. Unfortunately, that's the worst way to do healthcare. Why? Because by that time, the condition has gotten worse, and the door in the health system that they're going through, the emergency department door, is the most expensive door to walk through. There is no more expensive healthcare than in the emergency room. Yet that's where so many people who don't have insurance go when they don't have a way to pay. They end up having to spend whatever savings they have, which isn't probably very much, which probably stops them from ever believing they can own a home, which stops them from thinking they can afford to send their kid to college wherever the child wants. But they do it, right? Because you don't have any choice. That's your child. And the problem, of course, is it didn't pay all the bill, so guess who pays? You and me. As taxpayers. Or if you have private insurance. Why is your private insurance going up in healthcare all the time? Because when providers, hospitals, and doctors don't get payment from someone who came in, it's charity care. But they still got to pay the doctor. They still got to pay for all the equipment and the medicines that were used. So what do? They raise the price for private insurance companies for you. So to deny someone care is to just simply say you're going to wait till it becomes more expensive. I'm not going there. I was Secretary of Health and Human Services for the entire nation for 4 years. I saw how inefficient we can be by waiting for people to get too sick. We, in my watch, helped more people become insured with health care than ever in the history of the country. By the time I left, more than 300 million Americans had their own health insurance coverage. We'd never reached that level before, and that's because we really pushed hard on the Affordable Care Act and the marketplace. When we came into office in 2021 under the Biden administration, there were less than 12 million people who had their insurance coverage through the marketplace. Covered California here in California. By the time we left, about 24.5 million people had their insurance through the marketplace. On top of that, And on top of that, we expanded access to the Medi-Cal program, what's called Medicaid nationally, but we call it Medi-Cal. We expanded access that way as well. So that's how we got people insured, so they could come in. So here's what's going to happen when I'm governor. I'm going to make the message clear to all these families that are out there, especially the families that are fearing that they're going to lose their coverage under Medi-Cal. You're going to get your Medi-Cal. And that includes our farm workers, our undocumented, because they need health care as well. And what we will do, that's the good thing, because the message will go out to them. Don't wait till it's so bad that you have to go to the emergency room. That's the great part that we think about. But here's the even better part. And maybe there's some folks in healthcare who understand this. By making sure they have insurance, when they walk through that door and you're looking at them coming in as a doctor, a nurse, as the head of that clinic or that hospital, you're not looking at a non-paying patient. You're looking at a patient who's going to pay you because they have insurance. Which means this: you don't have to close the doors to some of your facilities because you can't afford to keep clinics open when you're not getting paid. The worst thing I can allow to happen is for hospital administrators to say, I can't afford to keep as many health facilities open because I'm not getting paid. So I got to start closing them. Guess where they close first? Communities like this. Rural communities get closed first. In fact, you've been losing some facilities already in this area. It's the toughest thing to keep a facility, health facility open in rural and ex-urban areas of the state. The worst thing I can do is say, oh, Donald Trump just cut $1 trillion out of the Medicaid program, and so I'm going to have to cut access to care. No, we're not going to do that. California will become the backstop. And the way I'm going to pay for it is I'm going to tell all those providers, doctors, lawyers, doctors, hospitals, clinics, okay, you have patients that are paying, always coming in. Now I need you to tighten your belt because you guys are spending a lot of money doing things that aren't actually providing care. It's paying administrative costs and bureaucratic costs. We're not going to go backwards. We're going to make sure everyone has health care. And that's going to help us out because I learned from my mom really well. Es mejor prevenir que remediar. It is better to prevent than to remediate. That's what we do when we give early, upfront care instead of waiting until the end stage when it's emergency care and it costs so much more. Okay. I got the signal from the real boss, my daughter. I went too long on that answer, so I'm going to cut it back down. Where's the second question?
Okay. Is there Gloria here in the audience?
Who?
Gloria?
Gloria. Okay. Gloria, you can read your question.
Javier Becerra, thank you so much for having us here. It's really an honor to meet you and really get to know you now. How will you work towards initiating universal health care for all Californians? Kind of piggyback.
Yeah, so Gloria, this could be a quick answer because I just told you how. We're not going to let providers go under, fail, because they're not getting paid every time a patient comes through their doors. What we're going to say is the state of California becomes the backstop. Essentially, the Medi-Cal program becomes the backstop. And what we will say to folks is, you can continue to come in and get your care. But the important part about universal coverage, about extending it to everyone, is that you're giving it to them early. When I was secretary at HHS, we tried so hard to try to move the health system away from just treating illness. We're very good at treating illness. We should be way better at promoting wellness. Starting here. First Five Foundation. You know this. And as I said, my mom said it so well. Prevent, don't try to fix. Actually, this is where I quote Frederick Douglass, another great American who said 160 years ago, it is easier to build strong children than to repair broken men. We spend so much money repairing broken men and women when we should be building them when they're young to be strong. That's what I want to do. So I'm going to move our health system as quickly as I can towards early upfront care. That means if anyone here that's young thinking of being in medicine, become a pediatrician, become a family doc, become an OBGYN, because you're the front door for healthcare. And I want to be able to front load healthcare so that people have access to that early care. And if I can do that, I could probably prevent the hospitals from having too many patients who don't pay, who need to be in their beds, the most expensive kind of care. So we will go to universal coverage because we'll make sure people understand you're not going to be denied coverage. You will have access to care. I will continue to expand the programs that the legislature and Governor Newsom started, which increase access to care through the Medi-Cal program. And even during these budget times, when they started to retract some of that, I will not do that. I will move it forward so we get to the point where all Californians have access to that care. Thank you. Next question is coming from Mauricio. Is it Mauricio? Is there Mauricio here? Yes, that's probably your case. En español, ¿verdad? I'm going to let you read it. Yo lo voy a dejar que usted lea su pregunta and I'll translate it. And then the next question will come from Marlo. Where's Marlo? Marlo, you'll be next. Chris, at any point, if you want to add something, please, raise your hand.
Bueno, primero, muchas felicidades. Tengo 40 años aquí en Estados Unidos y es la primera vez que hispano, mexicano, se avienta al gobernador.
Me gusta la palabra, se avienta.
Claro, pero también nosotros llevamos atrás muchas cosas.
Hágame el favor, señor.
Más rápido.
La pregunta, sí, por
Este-
si no, no vamos a poder contestar todas.
Si tú sabes que no vas a ganar tus votos que te va a dar toda esta gente, los traerías al siguiente.
So the question is, if I don't believe I'm going to win, will all the votes that are coming my way, will I try to redirect it to somebody who will win? Primeramente, voy a ganar. But secondly, and let me give you the honest answer, because I know that's on a lot of people's minds. We want to make sure that at the end of the day, we end up with a good governor. I hope that's me. But if, for whatever reasons, it's not me, there is life after running for office, and I will make sure that we do have a good governor. And what I will tell you is this. I think in the next month, probably less, we're going to know who really has a chance to be in the runoff on June 2nd. And honestly, if I can't get there, I'm not going to just spin my wheels. I'm not going to ask you to give me your vote and jeopardize the chance for a good candidate to make it into the runoff. And so, stay tuned. Let's watch. Be aware. Because still about a quarter of the public who votes isn't paying attention. And once everyone starts to pay attention, and with the news that just came out over the last day or so of one of the candidates, people are going to start to pay attention now. They're realizing, whoa, there's stuff going on. I don't fear that. I actually enjoy having a race for governor where you have lots of good candidates. How many times can you say that you remember that you had too many candidates to choose from in an election? Usually it's, oh my gosh, these are my choices. I hate when people say I'm picking the lesser of two evils, and that's the worst thing to have to do. And the other thing I mentioned is this. My parents came from Mexico, and they would always tell me, la diferencia entre los Estados Unidos y México, aquí el voto sí cuenta. In Mexico, they would say the difference between these two countries is that the vote in the U.S. does count. Because they were so accustomed to Mexico, where what they would call el dedazo. Whoever was the leader at the time, the president, once that leader pointed the finger at you're next, the dedo is his finger, el dedazo, you got the dedazo, made no difference how Mexicans voted. That was going to be the next president. And for about more than 70 years, the same party held control of Mexico's presidency. And we're not going to have a dedazo here. We should not. Although I will tell you, money is rearing its ugly head again, and the big money is now coming in and trying to do the dedazo. I'm going to fight that, and with your help, we will, so that at the end, it's not the dedazo, whether from money or from some political leader that chooses who's your next governor, it's you. And so, I don't think Mauricio no se tiene que preocupar. Aquí tenemos competencia. We have competition here. And let the best rise to the top. And those of us, if we don't make it there, I intend to, but if by chance we don't, then let's support the best. Okay. Marla, please forward the discussion.
Thank you so much, Javier. So I'm from Wonderwood Ranch, and we do equine therapy for trauma-impacted youth, including justice-involved youth. So I wanted to ask your position on juvenile justice, and specifically trying children as adults, because obviously I have a lot of kids who are facing that situation.
Yeah. So I'm going to take this from a few angles. One, when I was secretary, when a lot of the migrant children were coming across the border without adults, under our laws, the Department of Homeland Security, ICE, was not allowed to hold them for more than 72 hours. They had to be transferred to a more appropriate setting for a child, not for an adult in some kind of incarceration or detention setting. And so HHS, we had to find placement for these children. And we would always have to find a place where there was licensed care for these kids. What you learn really quickly from those who do the work in this field is that children, when they're young, their brains are still forming, physically they're still forming, and trauma lasts a long time. And so you have to make sure you're doing the best you can to provide that child the most appropriate setting to grow up. And so when you talk about someone who may have had a bad circumstance, or someone who came from a broken family, you have to try to lift them up. The worst thing to do is treat them like criminals, because they're experiencing things probably in their life that make it very tough for them. And so rather than come from the perspective of criminality, we should come from the perspective of healing. How can we put that person, that young child's mind and body in the right place? Anything with animals is going to help that child. I mean, animals just have a way of doing it. And the difficulty is, especially equine care, it's expensive. But man, is it rewarding. And so we have to figure out ways that we could provide young people, youth, with an outlet like that. One of the other things we did when I was secretary at HHS is foster care. There are so many grandparents who could and would take care of their grandchild who's now in a family that's been broken up, and they're about to be sent to a foster care program and go into a foster home, family they've never met. And the reason they don't come in and say, let me take them, is financially they can't afford to absorb the cost of caring for that child. They can't leave work or whatever the circumstances are. We started a program where we started to provide assistance to grandparents so that if they were willing to take that grandchild, we would make it so that they would not suffer economically by trying to take care of their loved one. What we found is that you get the best care from someone who knows you and loves you and is related to you. And we have to move that more and more towards that. And I'm going to try to move that more into the health system altogether. I already told you about having universal coverage. One of the things I want to do is move us toward home care versus institutional care, whether it's the hospital, whether it's the nursing home. My dad, and Clarissa, my daughter, will tell you, my father died in my home. My Carolina and I had my mom and my dad move in with us when we moved to Sacramento. And my dad, in his last years, he's been gone for about 6 years, he spent his last years with us. And during his hospice, his last 6 or 8 months, we took care of him. And he was surrounded by family when he passed. There's no way an institutional setting could have provided anything near that. In fact, he would tell us before, when he was clear of 6 months, he was not going to get better, he would say, do not send me to the hospital. And sometimes he had congestive heart failure, so sometimes we needed help to drain some of the fluids in his body. And he'd say, no, don't take me. I said, Dad, we're not going to leave you there. We just want to help drain your system. Your heart's not functioning well enough. He was so afraid that we would leave him in the hospital. There's nothing that beats home care. You know this because some of you were parents and you raise your children. It's better than sending them to some institution, some setting. We need to move towards more home care. The way we do that faster is by making it so that families don't have to absorb the economic cost of caring for them because they're family. Because most families will say, I'll do it as long as I can, but at some point it becomes financially too difficult. I can't do it. And then they get the loved one gets sent off to a nursing home, institutional setting. And the care is not the same. And so we're going to try to move more and more towards home health care. And I guarantee you it will cost less because those families will go above and beyond to care for that loved one. And we'll pay them something, but not the quality and amount of care that we're getting. So we're going to get our money's worth for helping make sure that that person gets the care that they could otherwise get at taxpayer expense at some institution, but we'll let them do it in their home. That's how we'll do these things. So John Silva will go next. John, where are you?
Right here.
Okay.
But you've already spoken about many, but I talked about CalCare.
Let's see. Will you be supporting the universal health care effort in California? Yes. Gloria? Where's Gloria? Did you already asked, right? Yeah. So let's go to the next one. No name. When will CalCare be a reality? Okay. That's on CalCare. Is that yours?
Out of the first 5 questions have been about Assembly Bill 1900, CalCare.
Okay.
Yes or no? Are you for it or not?
I am for getting to universal coverage. I haven't read all the elements of CalCare. CalCare is essentially universal. It's like a single payer program in California. I've been an advocate for single payer since the 1990s. If you go to my website, you'll see we have a clip where I look really young. Early 1990s, where I was speaking when the Clintons were trying to do healthcare reform about how the most efficient way to do healthcare in the US was single payer. And we, in Congress, we called it, those of us who signed on to the legislation, Medicare for All. And so yes, I'm absolutely an advocate. Medicare, if I say Medicare, people, who understands what Medicare is? Right? Most there. And certainly if you're 65 and older, you understand what Medicare is. And if I were to say to you, we're going to gut $1 trillion out of the Medicare program, I guarantee you, you would all be right now up in arms. Up in arms. Because that's what President Trump did to Medi-Cal, to the Medicaid program. He gutted $1 trillion out of the system. If that happened to Medicare, I guarantee you, seniors who vote would be up in arms and it wouldn't happen. Now, why don't we allow someone who's 64, not 65, because to be qualified for Medicare, you have to be 65 or older, or you have to be classified as extremely disabled. Why not let somebody who's 64 qualify to have Medicare, where you know you get a doctor, you know you'll have access to a hospital. That's essentially universal coverage. That's essentially CalCare. That's where we're going to go if I'm governor. But it's going to take time. And the reason it's going to take time, and you'll understand this, we have a health system that's got a ton of moving parts. And they don't always work well together. And that's why we pay more than any other country in the world for our health care. In fact, California pays more than any other state for our health care. All those moving parts that aren't moving parts with doctors and nurses, no, they're accountants, lawyers, pencil pushers. They're the ones that are in the fight. When you wanted to go get care and you got the insurance company saying, you need prior authorization? No, you can't go get it until we approve. Those are the guys that are interfering with care. That your doctor said, you need this, but the insurer, because of some pencil pusher, said, no, not yet. And that's what we got to extract. Single payer extracts all of that. And that's why it's more efficient. That's why other countries in the world are able to provide health care to everyone and at a cheaper price. Canada at about half the price we do. England for less than half of the price that we do. France does, you ever get hurt? If you're ever going to get hurt anywhere in the world, get hurt in France. Because they will not ask questions. And you probably walk out without a bill. And they could afford to do it because everyone pays into the system. So to get there, to get to a single payer or some form of CalCare or Medicare for all, we have to reform our laws, federal and state. If you get your insurance through your private employer, your insurance coverage is governed by ERISA, E-R-I-S-A, employer, blah, 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 blah. I don't remember it all. The ERISA law. We would have to amend the ERISA law because it determines how your insurance is covered and how employers can deduct the cost to provide you with insurance. All that has to change because now it would be under one system. We have to reform Medicare because Medicare is at the federal level, not at the state level. So we have to figure out how we'll deal with CalCare for those 65 and over. Maybe the feds give us a waiver to include the Medicare program within CalCare without making any changes. But we still need the feds to write a law that lets us do that. Medicaid, which we call Medi-Cal, for low income. We have to make changes to the Medi-Cal law, which is federal, in order to conform it to meet the Medicare for All program in California. We'd have to make all those changes to make it work. And we'd have to transition it because up front, right away, everyone would start paying for that care. If you're still working, if you look at your paycheck, you see the FICA deduction. That FICA deduction, that's where you pay your Medicare. That's where you pay your Social Security. Every time you have a paycheck, you pay. That's the same thing with single payer. Every time you have your pay, you pay. Nothing different. The big difference with CalCare, no more deductibles, no more co-insurance, no more of these heavy premiums, because now you're paying it up front, and everyone is paying. We can get there. It'll take time. And we have to get the system, all those providers, to change the way they do business. No more fighting on how they bill and how insurance companies will pay. But it will take some time. But that's where we're going to go. And that's the way you make healthcare for all more affordable without making everybody pay so much money. Okay, let's go to the next question. I don't see a name on this first one here. I don't see a name on the second one, so let me just go to the first one. I've seen many businesses closing in both Salinas and Santa Cruz lately, but there doesn't seem to be much interest in investment by the federal or state governments or through ballot measures. How do we grow our economy in this environment? Who asked the question? Yes, sir. Matt, was Matt?
Yeah.
Matt. So how do we grow we're going to have to do some things to make the environment healthier for investment, which means trimming back on some regulations, trimming back on some of the fees that government, local and state charge, accelerating the pace at which development can occur so that you as the person that's about to want to build that home or that commercial building can see the horizon when it's going to finish, and you don't have to try to spend so many years trying to make it happen. Remember, time is money, and the more time it takes, the more money it costs. And so we can do all those things, but we have to do it smart. We're not going to be the wild, wild west and just say to everybody, build wherever and however you like. You know that's not possible because you don't have enough water, and it'd be tough. So what we have to do is make it so that people can see the end of the horizon. They can figure out their costs. If you own a business, I'm not going to surprise you if I tell you that what you want is predictability. You got to pay taxes. You want to pay the lowest you can in taxes. But if you know what your taxes will be, you can at least then factor that in and try to see if you can make a go of your business. But if 1 year your taxes are this amount, and the next year they're going to go to this amount, and then the year after that they're going to go down here, you can't predict what your business environment will be like. You need predictability. You need stability for your business to be able to operate well. If you're doing this much business now, while the tax environment is okay, it's low, but then the next year goes way up, you may have to make decisions about letting go of some of your staff. And then if you let them go and all of a sudden the business climate gets good again, you may not be able to find those workers anymore because you let them go a year ago. You cannot be going up and down, fluctuating with the uncertain times. You need predictability and stability. I saw that 20 years I sat on the Ways and Means Committee in Congress, in the House of Representatives. The Ways and Means Committee is the tax writing committee. You need to provide local communities with some predictability, some ability to forecast what they can expect so they can make plans. No business person starts a business saying, I'm going to make a go of it. Who knows what will happen next year? I'm going to make a go of it now. No, you're trying to figure out, how do I survive 5 years? How do I get to that 10th year? And you have to have an ability to have some prediction, some stability in mind. And so the best way, Matt, I can tell you is that working with Supervisor Lopez and your local leaders, we will figure out what is it that you need to make the environment for your development not just healthy, but smart. And that's how we go. And the state should be your ally, not the impediment to make that happen. Okay. Let me go to the next question. The support for the black community is often forgotten in our state due to other topics. How would you seek to lift up the social justice needs of the black community? And who asked the question?
I did.
And your name is?
Francine.
Francine, thank you very much.
I asked two, though. I asked about early childhood, too.
Okay, well, let's see if we get to that one too. But Francine is asking about not forgetting the black community. Let me tell you the best way to do that. And by the way, not make any other community feel like, well, you're favoring one community over the other. When I was Secretary of Health and Human Services, and we were trying to figure out how can we, out of COVID, we were coming out of COVID, how can we improve the health of all our communities? Some things stood out because they've been like this for a long time. You're probably aware, because you have a shortage of healthcare providers here in this area, that in some places, the outcomes for mothers, new mothers and their babies, are as bad as you find in developing countries. Right now in America, a black woman who has a child is 3 or 4 times more likely to die or have a bad outcome as a result of her pregnancy and delivery than a white woman, under the same circumstance. So if you're a black woman who's a professional and doing well, you're still 3 or 4 times more likely than a white woman who's professional and doing well of having a really bad outcome, including death. We know that. So what can we do? This is what we did. Under the Medi-Cal program, that program, when we came in, used to offer a low-income woman, any low-income woman, when she was having her baby, 60 days of care after she delivered her baby for her baby and her. So whether or not her income was just above the Medi-Cal limit, she could stay on with Medi-Cal for at least 60 days to get care for herself and her baby. But after the 60th day, unless she was truly poor, really poor, she would lose that coverage. And who knows if she was going to have access to any other kind of health coverage. Well, it happens, if you look at the research, that the bad outcomes for so many of these women, and those of you who are women who have babies could probably attest to this, occur within about the first 6-8 months. Why? Because of the pressures of being a new mother. If you're working, if you are a single mother, if you are low income, all of those things are piled on you, and you have to be able to take care of your baby. And so many times, the stress, mental, physical, takes a toll, and sometimes you have bad outcomes, not just for the mom, but for the baby. We responded. Today, after we left, but now today it's still in place. Now let's hope it survives. Today, a new mother and her baby receive not just 60 days of care after they deliver. They get care for 365 days, for a full year. We extended coverage for not 2 months, but for 12 months. Because we wanted to make sure that mom and baby got through the hump of that first year of life and caring so that they could be stable. And we believe that's going to help nurture a healthy baby and keep that mom in a place where she's stable. What else did we do? We expanded care under the Medi-Cal program so that now doula care, which is care before the delivery, would now be reimbursable by the Medi-Cal program. Before, most doula care you could not get reimbursed for, which meant we were leaving a lot of pregnant women who didn't have good access to care without any care as they go through their 9 months of pregnancy. Now, under the Medi-Cal program, you can get care up front early, what we call doula care, or sometimes in Spanish we'll call them promotoras. They are there to try to help ahead of time. So we did that as well to try to help where we knew in communities there was going to be that kind of a need. And while we did say it's only for the black community, the truth was that the worst outcomes when it came to postpartum circumstance are in the black community and in the Native American community. And you can understand why. Access to care is very limited in many cases for some of these families. And many of them are lower income and don't have good options when it comes to health care. So we did programs like that. COVID, the reason we got to some 700 million shots that we put into the arms of Americans throughout the country was because we didn't wait for folks to come to us. Remember how we started standing up all those big events in the stadiums and in parking lots where you get your COVID shot, you just had to drive by and you get your shot? We started doing that, which we thought was going to help us get to a lot of folks in poor communities that were often left out, people who were uninsured. And we did, but there were still people who would go because they had 2 jobs and they couldn't go, or they had to take care of their kids afterwards, or they didn't have transportation. So what we did is, I told my team, well, okay, we set up these places, not everybody came. We can't wait just for them to come to us. We're going to go to them. So we started using churches, schools, coaches, beauticians, anywhere in the community where there were trusted voices. We'd say, could we do a vaccine clinic in your shop or in your parking lot? So we get to folks that didn't come to the big sites or couldn't come to us during regular hours. And that's how we were able to get to so many people. And in the time I was there, where we were starting to see the disparities growing between the people who were getting vaccines and those who weren't, when I got in 2021, I started in March of 2021. By, I think it was beginning of June, when I was getting daily and weekly numbers, By June, it was clear. About 2/3 of white adults in the country had gotten in June 2021 at least their first vaccine. Less than 50% of Black and Latino adults had gotten their first vaccine by then. By the end of 2021, December, when we started getting our numbers in January of 2022, more than 90% of white adult Americans had received at least one shot of vaccine. So had 90% of Black, Latino, Asian, Native American. We erased the disparity that existed in getting vaccinations because we didn't wait for folks to come to us. We went to where they were. And that's how we were able to make it possible for us to recover from the COVID pandemic faster than would have otherwise been possible. I think we're getting close on time, right? 6 or 7 minutes. Wow. I talked too much. Okay, next question, no names, is childcare and early learning. And I think you're saying childcare and early learning are critical for our economy and social progression. Do you support the Choose Children platform for comprehensive early childhood parental support? The answer should be pretty obvious. Everything I've said is I'm going to upfront care. I'm going to follow Frederick Douglass and my mom's advice. And I'm going to build strong children. And I'm going to prevenir, no remediar. And that means I got to start early. But Carolina, Dr. Ray is my wife, used to work for First Five. When we were in LA, she started a program called Best Babies Collaborative, which essentially said, if we're waiting till they're 5 to start to help them in the first 5 programs, we're waiting too long. We got to get them, as I just said, before they deliver. Because we got to teach them, those families, and have those kids learning early. So what I will do is put up care up front. And that, of course, means when it comes to child care, we can't let money determine who gets child care. It can't just be that those who have the most wealth are the ones who get the best care. We have to make it available. At HHS, thank you for coming, I ran the Head Start program. And one thing we did to try to help on Head Start, because there are so many families that could qualify for Head Start, but we don't have enough slots for all the families. But believe it or not, of the slots that Congress makes available for Head Start, they make about 750,000 slots available. About 760,000 slots Congress funds for Head Start. There are many, many more families and kids that could qualify, but they gave us funding for about 760,000. You know how many slots actually were filled? About 660,000. Why would they not fill 100,000 slots? I'll tell you why. They couldn't find teachers in those centers to open up more classrooms. Why? Because the pay that Head Start teachers get is so low that you could easily go flip burgers at a fast food joint and make more money than teaching a young child in a Head Start program. And so I said, well, that's what I always tell people. When it's on you, you're the executive, and you got to make the decision as a CEO. You got to make things happen. You got to deliver. So I said, why don't we take those, what I called phantom slots, that 100,000 slots that we're not getting used in the Head Start program. The money from those phantom slots that centers could not fill because they couldn't find the teachers, let's take that money and use a good chunk of it to increase the pay of Head Start teachers. We figured we could increase their pay about $10,000 to get them closer to what a preschool and kindergarten teacher makes in the country. That regulation we passed is still in place. It's supposed to start to come into effect in the next year or two, unless this administration gets rid of it. But what we're trying to do is be realistic. We can't use 100,000 of those slots and the money for those because we can't find the teachers. Let's stabilize the teacher corps. Let's make it so people want to stay in the profession by paying them a real wage that they can live off of. And so hopefully this is going to start to make it so that Head Start actually can bring in more kids. And people say, well, if you took the money for that 100,000 slots and it's no longer there for slots, you can't go beyond 660,000. And I say, well, wait a minute. If we have teachers that are available, I guarantee you the parents will go to Congress and say, you need to put more money in because we're not getting in and we know that there are teachers that could teach. We have to build it so that people will demand it. Right now, people don't know they can demand it because there aren't any slots and teachers that are available. So that's what we have to go. And that's what I would do on the issues like childcare and early learning. Next question is, what does... Next question, I know we're down to the last couple. What does justice look like in the wake of the Trump administration? And here I'm going to ask Supervisor Lopez to answer as well, because he sees it on the ground every day. Here's what I tell you what it looks like. It looks like us voting in massive numbers in November. To make it clear, we're not putting up with this. We're not letting you try to make it look like you're going to suppress the vote or challenge us. We're going to go out and say to you that in the face of your hostility, we're punching back. I used to tell my team when I was the Attorney General in California, when Trump was the president the first time, I would tell my team when we saw the things he was trying to do, I said, we need to be ready to counterpunch before he punches. We don't want him to believe that he could just go at us like a punching bag. No, no. Before he lands a punch, we want to make sure our counterpunch has already hit him. And that's what we did. And ultimately, by the time I had finished as AG after 4 years, we had gone toe-to-toe with Donald Trump in court more than 120 times. And almost always we beat him because we were ready. We didn't wait for him to try to land his blow. And that's what we got to do here. We got to let him know we're not going to let your craziness dictate what happens in California. We're going to counterpunch. We're going to come out in massive numbers and vote. And we're not going to take your insanity because you take $1 trillion out of healthcare and say now we're going to deny our families access to the doctor or the hospital. No, we're going to do just the opposite of what you're talking about doing. We're going to make it available and we're going to show you that we can do it with less cost. Those are the things that we'll do. And that, I hope, will wake people up to see that you don't want a menace like that to be in charge again. You want people to actually believe in the government. I'm going to ask Supervisor Lopez for his thoughts.
The system's under pressure. Right now, it's not broken, but we're watching what happens when we fail to buttress a system that we believe in. Our democracy is strong because people are the basis for it. We empower DC. We also empower our state. There's certain powers which we held back as states and said, this federal government cannot have that. We're going to embed that with our states. And how states respond to what we're seeing at the federal level is how we fight back. It's how we define justice. And it's how we set a threshold on what we will allow to happen in our nation and around the world as people look at us. That shining beacon on the hill, we're often referred to that as a nation. Right now, many have told me it feels like that light is dimming. But when I see leaders like Xavier willing to step up in California, reignite that flame and put it at the top of the hill and say, no, there's power within the states, the power's within the people, and we're going to hold the ground. We're going to hold you responsible. We're going to challenge you to say these are our ethics, our values, our morals that we define as the people who make up these United States, but it begins with the states and powerful leaders willing to hold accountable those who think they can run over the legislative arm, run over the judicial arm. No, we have to stand them back up. And we do it with strong leaders by electing them and putting them in office to help us be a key voice, not a soft voice, not a moving voice, one that is willing to every day wake up and reignite that flame and say, that is who we are. That's why I'm here supporting Xavier. We do it by supporting leaders willing to uphold our values and be a reflection of who we are. I see a man here, child of immigrants, fought his way to the top, served the entire country. Now he's home to serve us here in California. And that's why he has my vote, and I hope he's earned yours as well.
I got to take him everywhere I go. By the way, I should also mention, there are efforts underway right now, you probably heard about them, to regionalize some of our governance. You heard about the cuts that are occurring for cancer research at the National Institutes of Health, the research on Alzheimer's that's being cut by this administration in Washington, D.C. We have some of the best institutions, our university research centers, that do much of that research and science that leads to these great discoveries. There's talk already going on about China provide regional centers that would replace what was dropped by the Trump administration at the National Institutes of Health, so that we take the power of, I know Washington State, Oregon, Hawaii, and some of the East Coast states, Massachusetts and others, have talked about how we try to come together and form a bloc that can pool our resources to continue some of that research that was now gutted by the Trump administration. So there are regional approaches coming up. Some of us are trying to figure out if there's a way that we can regionally hold our taxpayer dollars from going to the federal treasury until we get our money back. And that's a little tougher, but we're trying to figure it out because you know, California pays more in taxes to the federal treasury than any other state. Yet we're not getting our fair share back. How do we make it so that we ensure that we're getting our fair share back? We're trying to see if there's ways that we can do that. Very difficult, but we'll see. But the best thing we could hope for is that we're going to start to have at some point an administration in Washington, D.C. that actually wants to work with the states, not fight with the states. But until then, we counterpunch. We'll be ready. Let me close by saying this. Love coming. Thank you for taking the time. I hope you'll take an interest in this race. I hope you won't wait till June 2nd to pay attention. I hope you'll get family and friends and neighbors to know that there really is an important race for governor going on. And there's some candidates that are actually trying to reach out to them. I hope you'll let them know where they can find that good information. Real information, not disinformation. And I hope at some point you'll say, I want to help Javier. And how can I do that? And find out. And whether it's you see Clarissa, my daughter, walking the streets, or at the first 5 commission meeting, or you see Supervisor Lopez at the county how administration doing his business, ask, how can we get involved and help? Because we need to get out there and be ambitious. We have to be aggressive, and we have to be the difference. And so I hope I have an opportunity to see you again. I hope you are prepared to help us make this a good election. And I hope at the end of the day, you still have hope that this will change, that this is not our circumstance in life, that we're doomed to have to live with these man-made disasters over and over again, that we will escape that and find a better day. So you came, that gives me hope. I hope as you leave, I've left you with some hope as well. Thank you for coming. Enjoy the rest of your day. It's going to be a nice day.